changing over coming years, especially when it comes to things that we're still wrapping our heads around, like the public health effects of environmental changes and climate change. Is that something that you're worried about, the ways that climate change will affect general public health, but also specifically for poor and Black and brown people?
Climate change is the most pressing public health problem we have today. It's more dangerous than anything else we've got. And yeah, I'm worried about it. I'm worried about more severe storms, including more hurricanes, more tornadoes. If you were in DC just yesterday, we had lots of, severe storms in our region, including hail and high winds, et cetera. That is not an accident. That's happening because our climate is changing, and we are part of it. And we actually know the solutions, the science is there, and we just have to press on it to try to fix it. And as you pointed out, the people who are the least involved in creating the problem are the most impacted by it. Think, New Orleans, think Houston, think Puerto Rico and the Virgin Islands. Those are examples of the disparities that we're seeing.
Dr. Kumanyika, how do you see climate change affecting?
I agree totally. Besides the fact that climate change is our biggest problem as a whole, it is the most vulnerable, the people with the least power and resources who can come back from it. Because once a disaster happens, guess who can go out and build a new house? Guess who can get their kids back in school? And guess who can't? So it's a general problem, and it's a part of health disparities. And a lot of people don't realize that. They think, oh, that's way off there. That's the North Pole and some polar bear that nobody cares about. And what about here? Well, here,
it's coming for us too.
You have probably kids that are still not in school because the school was blown away and the community is not able to really create that again.
Yeah. We have a question from Twitter.